Just like you presented with symptoms that were what I call peripheral symptoms of dry eyes, meaning the patient doesn't actually say, "Doctor, I feel dry" or "I have dry eyes." You came in saying, your contact lenses are becoming intolerant, correct?
That's correct.
And difficulty as far as the day goes on, as evening comes on, your eyes feel heavy, burning,
Yes.
that kind of symptoms. So dry eye is actually a spectrum of disorders, and to treat dry eyes, obviously you have to provide a spectrum of treatments, which may even include combinations. So now you see how dry eye itself, the treatment becomes a science rather than just throw something at a patient. First of all, dry eye affects, I believe, quite a range of the population, even though the most common people affected by this are female women over the age of 40. But as you just saw this other patient, the young guy from California, I have seen it in all spectrums. This is where it becomes important to first determine if the dry eye is associated with a disease in your body or it's just dry eyes by itself. So diseases like rheumatoid arthritis, Sjogren's disease, these are actually conditions in the body that may have dry eyes as a part of it. And being an eye doctor should be vigilant enough to look for those conditions and rule them out, because otherwise treating that condition actually corrects the dryness, right? Then dry eye could be just dryness by itself. And when that's the case, dry eyes could be of the following kind. The tear production may have decreased, or the tear evaporation may have increased. So think of it as, if there's less production of tears, you're dry. At the same time, if you're producing enough but you're losing a lot to evaporation, or in your professions like computers and graphics, you're watching the TV or the laptop all the time, you forget to blink, and there's more evaporation going on. So the tear film itself is made up of 3 layers. The first layer is called the mucin layer that attracts the tear film to the cornea. Then is the main tear film, and then there is the oil layer that's produced by your lids that maintain the tears vertical. If you ever imagine how a fluid wall can stand against gravity, that's how it works. So given that you understand how dry eyes have 3 levels of tears in it and what are the ways it can be dry, your treatment has to accordingly be designed for that particular patient. So the first thing I did with you, just like anyone else, we did a thorough check, also checking your family practice doctor and making sure you have no condition associated with dry eyes. Second, the kind of dry eye that you had was evaporative. So we had to use what are called plugs, lacrimal plugs, because the tears are taken away by tear ducts, one in each lid, towards your nose. That's how your tears exit your eyes. But if you block the tear ducts, then you can keep your tears in your eyes for longer. And your tears are the most comfortable for yourself, right?
That's correct.
So that's what we did for you, because you had evaporative dry eyes. Also, people like you who wear contacts and who may still not be ready for laser vision surgery, your contacts require enough lubrication for it to move gently on your cornea. Otherwise, remember, your symptom was your contacts were feeling tight and you were irritated by evening.
Yes.
Right?
Yes.
So that's a very common complaint, and you have to look for dryness there. Then, of course, LASIK. Remember, traditional LASIK does cause dry eyes because to make the flap, you have to cut through the nerves of the cornea, which do regenerate but causes temporary dryness. But being somebody who does different levels of laser vision surgeries, you can still design a laser technique beyond LASIK in patients who may have some levels of dryness, or treat the dryness and then do LASIK. So you see how you can work around the whole system. Now, dryness can be treated as simply as using artificial tears, correct? That's when there's deficiency and there's a low level of dryness going on. So you can use artificial tears in combination with lacrimal plugs. Then you can use various medications like Restasis that helps production of high quality tears. Even artificial tears, as you know, you've been to the supermarket and you'll see this array of colors in front of you and you'll go like, what do I use? So there are so many kinds of tears based on this logic of the chemical nature of that drop, the long-lasting effect, and also the comfort level. So you have gels, liquids, and creams. So again, levels of even the composition of the tears. So tears, the kinds of tears, the plugs, the kinds of plugs. Temporary plugs, permanent plugs. And then again you have design and material differences. And then of course you have higher levels of treatment if you don't respond to that. besides medication like Restasis and steroids, is you can even do surgery using human amniotic tissue that we do with glue, no stitches. And again, depending on the cause, you may have to operate on the real causative structure to help that patient long term. So in summary, what I like to always say when I teach eye surgeons is dry eye truly is a spectrum disorder. It's a disease which may present as a spectrum of symptoms and has a cause as a spectrum of causes. So the treatment also should not be a shotgun treatment or take these drops and go home. No, it has to be designed to that particular situation. Then we achieve tremendous success because just like in your case, I'm sure you can relate to it as a patient. And what we discussed today is, tell me the reaction you felt once you were treated. I mean, how did you feel?
I felt great right away. The procedure actually didn't take long. It took just a few seconds. Went home and I said, wow, it felt great, doctor. And I honestly, I can't thank you enough. It just feels wonderful. My eyes are not dry anymore. I don't have to just stick my finger and move my contact. It's just kind of just pour them and just, that's it. I mean, it's just amazing. It feels really good. Excellent. And I want to thank you so much for explain everything to me.
You know me, you know our practice. I mean, being a teacher to eye surgeons, educating patients is so important to me. So that's again where I'd like you to take your time, because what you have to realize also, Jed, is, are you getting the best treatment? Are you getting the most logical treatment?
I am.
You know?
I am. And honestly, doctor, I will tell everyone out there, anyone who got dry eye, who got problem with their eyes, please come to Dr. Galliani, because he is really the best, and he can teach you more about yourself than ever.
Oh.
Thanks
Thank
again.
you so much. Thank you, and enjoy that, and see you again.
Thank you very much.